welcome to AMC Connects. Really excited for this episode. It's such an important topic. If you haven't heard, because perhaps you've been under a rock somewhere, I have been too sometimes, on the topic of artificial intelligence. It's almost like you cannot look up, be out from under your very focused life without hearing about artificial intelligence. And without further ado, we will have an episode that starts to introduce this really important topic in healthcare, because I'm so excited that we have an internal expert emerging within Rome Health. It's a guest that you know, the community loves, and we're excited to have him on again. But before we get to that, which is such an important topic,
Such
can't
a
wait.
teaser. Oh my gosh.
It is. Chuck, I know. I'm getting so good at that. And it's part of the reason why I'm all dressed up. I'm dressed up today because this particular guest is somebody that you have to be on your game with, because he is one that just embraces all things that are new, innovative, and challenging within healthcare, at the same time taking excellent care of patients and so many of us to do our jobs. Before we jump right in, if you didn't watch last week's episode, there were some changes. Right, Chuck? There
Absolutely.
were some expectations.
There's
some of you, yes, that watch the podcast that pick up on subtle changes. Those people can remain nameless because I've heard.
Name
yes. Well, if you want to disclose yourselves, you can. But somebody had come up to me in the hallway many months ago and said, I'm picking up on the subtle changes happening in the podcast, and don't think we don't know. So perhaps you did put them in the mailbag, or let Chuck know if you don't want me to snag you into the conversation. But in all seriousness, last week's episode was starting to implement some changes and setting some stages. So if you missed it, quick recap. We're making it easier for patients to access specialty-specific care. The "We Can See You Now" mantra within Rome Health is really focused on making sure that our subspecialty services, because we've invested a great deal in them to help support our primary care, our emergency department, and our community overall. So we're very excited to continue to pick up the pace on "We Can See You Now," which is getting back to you for anyone who needs to see a specialty-specific service that we have within 24 hours. And there's a number of specialty care that people didn't know that we have. So we announced last week that we're embarking on an internal campaign through Cassie and Chuck that will make sure that we all know all the services within the network that are provided. We took a closer look at some of our greatest strengths in our nursing work, and we had recapped Ashley Edwards and Michaela Turnbull doing amazing things with our Transition into Practice program. And your feedback drives change. I talked quite a bit about that. I have heard from the community some areas of opportunity that we've been working on for some time, that we have to continue to bridge some of those gaps, like rescheduled appointments. We're working on that pretty vigorously. And certainly having the workforce, all of you, have all the tools and resources you need to provide the exceptional care that we all are working so hard to provide. We talked about that. We also talked about transparency remains a high priority. That was a first ask when I came to Rome over 5.5 years ago now, was that everybody wanted me to make sure that when I know something, you know something, that you're not finding out things at the grocery store or at your children's sporting events, or in some other way other than what's coming through a pathway of communication at Rome Health. We also talked about celebrating those who make such a difference. We have the Care Awards that we give out, and Employees of the Month and of the Year. And I was so pleased that the Wellness Committee has continued to highlight our exceptional leaders that come from every area of the workforce. So please tune into that and high-five them. And of course, if you missed the episode, you always have a chance to be able to view it again if you missed it at the first launch. Without further ado, one of our CareSync leaders and physician leaders throughout the Rome Health Network for a number of years now, I'm joined on this episode with Dr. Michael Attilio.
Yay.
Dr. Attilio, yay! We do that. Chuck and I do that.
All the time.
Yes.
You must be a watcher of the podcast, because we don't know if people are clapping for us, but we clap for ourselves.
Well, yeah,
here.
it's either clapping for me right now or this guy again, like cue disappointment.
What?
Yeah.
Well, that's a great start, Dr. Attilio. What's been going on? How have you been doing since last on AMC Connects?
Okay.
Like, wow, when you were last on AMC Connects, I promise I'll stop talking.
No, please.
But I get so excited when you're around. It really, my energy level goes so high. But when you were last on, we were like making sure people knew who you are, which so many people do, and the great work you bring to the community. But we are announcing your role as Chief Medical Information Officer, which is another new role for you for Rome Health, which you're hitting it out of the park. goodness, because we have this huge lift of an EHR project.
It's a big one, yeah.
Transformational. We were able to get the grant. Plus, we had some pretty big leaps and bounds we had to get through the last time you're up. So you've been just.
And we were talking about just how we were picking things.
Yes.
We were that early in a process.
We were that early the last time you were on.
Yeah.
So you were just kicking up your heels and eating bonbons since the last
Pretty
time.
much, yeah.
Did you accomplish everything we set out to do?
So where I have been, and Nancy Levitt and others have been, is this is like hurricane care sync. And I'll tell you why, right? So last time we were here, we were like, okay, we got to choose something. And we went through a heck of a lot of work, and a lot of people in the organization did some really, really excellent things to help us do that. But we chose our future EHR.
Congratulations.
Meditech Expanse, which is going to be, I think, a really excellent fit for us, right? And that took getting a lot of people into rooms and doing demos, and the list goes on and on. But it was a flurry of activity.
Yes.
And right now, it's like the eye of the hurricane. Everything seems just calm, right? Because mostly we have to do our contracts and the normal business-related stuff. So in the organization, it doesn't feel like a lot's going on right now, but in the background, there's a lot happening. And then all of a sudden, probably a couple months from now, it's going to get really crazy again, and the hurricane will pick back up, and yeah, it's going to be fun.
I like that.
It's going to be fun, yeah.
The hurricane flurry.
Yeah.
You signaled this a bit because what I really appreciated about you is you're such a systems thinker.
I was just going to mention that.
Yes. I mean, you're excellent patient care, and to have somebody who's so phenomenal at delivering patient care, plus has leadership skills, plus has a systems thinking, what you brought to this phase of our journey was a real process to be able to think through. What I loved about you was you were not walking into this journey for us with like a preconceived notion.
No,
that the process was what you were designing and engaging people, but you seemed pleased with the choice and with the selection.
Absolutely.
Yes. Okay, can you share with us just a tidbit as to why you think that it's a right choice for us?
Absolutely. So I think we talked a little bit about the options last time. At the end of the day, the two vendors that we had come in and do demos for us were Epic, which most people are familiar with, and then Meditech and their new EHR called Expanse. Now, we know a lot of people that have used Meditech products before, but it was sort of their old EHR, and they've rebuilt Expanse from the ground up. There were a lot of key factors, as a matter of fact, 5 specific ones that we were looking at in our selection, right? Because we had to make sure that we picked something that met our strategic needs, right? Met our clinical needs. We have to support what the other clinicians and I do, and the nursing staff and everybody else in taking care of patients. We had to make sure that it was something that we could afford, make financial sense for us. And the list goes on, but at the end of the day, Meditech has been a company that's been around for a very long time, right? And they specifically support a lot of organizations our size with our needs. Epic is a wonderful platform, but it's really designed for larger tertiary care academic institutions. And with that, it's very good, but it also tends to be very expensive. And this really wasn't a decision about affordability. I don't want to give people the wrong impression, right? But there was a lot to consider there. At the end of the day, though, in my mind, it came down to this is the right sized product for us with an organization that works a lot with organizations like ours and is ready to support us specifically in our mission, right? Because remember, too, that the other thing we had to consider with Epic is that with the size of our organization, we weren't in a position to go buy it directly from Epic, right? So if we were going to use it, we were going to have to go to a partner who already has Epic in place and say, hey, can we use yours? And I'll give Nate, our VP of Finance, credit for this. Nate's analogy was fantastic. Going that direction would have been like renting a house from somebody, right? Where you can live in it very comfortably, but you can't really do a lot to it. You can't make major renovations. You can't customize it to fit you. You can put some pictures on the wall and maybe some paint, but what we want is for Rome Health to be the master of its own destiny, right? And we weren't necessarily going to be afforded that opportunity with an Epic model, but Meditech Expanse gives us all that and then some.
Yes.
So that's a decision in a nutshell.
Oh, it's a great summary. Really appreciate it. And I like that you underscored a bit that Meditech as a company has had many decades
Oh,
of
absolutely.
service to healthcare, and that they
Multinational service to healthcare too. That's an important one because people oftentimes fail to think outside of the walls of, the United States healthcare system. And Meditech is a global company.
Yes. Which what that really says to me too, in addition to investing in the ways that they have, is that it's a solution that can apply to many demographics.
Oh, absolutely.
Which we know we have a lot of diversity within Central New York, and we want to be able to meet those needs.
Yeah.
Well, I'm very excited to be able to have you on because naturally, which I was hoping for, praying for, and just knew you would deliver on and exceed expectations, was this topic of AI. Yeah. We've been hearing about AI for a number of years now. You've been getting educated, conferences, whenever I've gone out, like outside to try to learn, there's a lot of discussion, and now it's coming fast and furious with AI and healthcare, right? Yeah. And so I'll give you the two polarizing views that I've been hearing about, and then would just love for you to close the gap for us a bit. On one hand, I heard people recently talk about, I think we both did, a leader in Central New York healthcare who said that they really believe AI is going to be their key strategy to viability and sustainability because it can absolutely change the picture for community-based or rural-based healthcare. Yeah. I mean, wow, right? That's a pretty bold statement. Yeah. Then on the other hand, a polarizing view is that AI is going to be replacing every healthcare job. And we're going to lose great clinicians in the workforce. And so what have you learned, and where do you sit on this topic, Dr. Attilio?
Oh my goodness. Okay, you warned Chuck that this is the special 3-hour episode.
I know,
right?
I know.
Wait, why did I turn on the timer?
I know, I know.
No, in all seriousness, I know we don't have a lot of time. So this is something that hopefully we can revisit.
Yeah,
right?
yes,
Maybe here on AMC Connects or in some other ways. But AI is an incredibly complicated conversation right now for a lot of reasons. Number one, it's truly complex. Number two, it's very new, right? So the 2 points that you bring up, I think, are sort of the hot button topics in a lot of this. And I will say that, this is generally where I sit on AI. Yes, AI is the future of healthcare, right? In part, right? But, and the clarification to that statement is AI is the future of healthcare alongside us, right? There's a lot of fear driven out of these contextual conversations of replacement, right? Like nurses feeling like they're losing their jobs to AI, or physicians feeling like they might lose their jobs to AI, or insert your position here and losing it to AI. But I don't think that's the case, right? And that's honestly the biggest thing. And I will tell you that the reason I'm truly confident that this partnership between humans and AI is going to make it work is for a couple of key reasons, right? Number one, I'll abridge the summary for you, but in 2011, there was this article that came out, medical journal article, and it was focused on medical education, training new physicians, but they were estimating how long it took for the medical knowledge in the world to double, right, at different phases. So short version, in 1950, they estimated it took 50 years for the knowledge we had in medicine to double, right? So your doctor in 1954 knew everything he or she needed to know, right? And by the time we figured out more, they would retire. Fast forward, and remember this is a 2011 article, they estimated that by 2020, the doubling time for medical knowledge was 73 days.
Wow.
2 months, right? So if you saw your doctor 3 months ago and they're right, your doctor knows half of what he or she needs to know right now, right? Now that's beyond human capacity, right? So enter AI into the conversation, right? A lot of times we get focused in these technology conversations about what AI can do that we're already doing, or what technology can do that we're already doing, right? It's called the Turing trap because we're just thinking about what we're already doing, right? We're now entering a phase of healthcare where we have to think outside of that bubble and go, what can I do? What can Dr. Attilio do that he could never do before because this technology exists, right? And that's a partnership. That's not a replacement.
Oh, I like that.
Right?
Yes.
The other thing that comes up a lot is we're like, hey, we're going to lose our jobs. There are a lot of estimates out there that say we have still dramatic tens of thousands of numbers and shortages of physicians, nurses, other
Yes.
healthcare professionals, right? It doesn't make a lot of sense to make a prediction that we're going to start replacing people when we don't even have enough to begin with,
Yeah.
right? So yes, this is normal for change. People are afraid. People don't know what's coming down the road. But it's really incumbent upon us to define that future and sort of understand how this partnership works. And that's where this systems thinking that you were alluding to comes in. I'm not an AI expert by any means. I can't tell you exactly how it works. But my role for the organization is understanding what exists now, where it's going, and how we start to integrate that into what we're doing now to build a healthcare system that's totally different 3, 5, 10 years down the road.
That's so awesome. So have you implemented some AI into your practice?
Yes. I use it a lot. Actually, I probably could use it a lot more. On my administrative front, I use it here and there, mostly for simple things. On the clinical front, which is really what people are interested in, it's extremely useful, and we use it in a lot of ways. Many people are familiar with the fact that for a while now, we've been using AI to help write our notes. It's called ambient AI. Sort of runs in the background, listens to us talk to patients, and it takes that 3 or 4 hours of time that we spend in a day writing notes, and it condenses it to a couple minutes, right? But the nice thing about what we have right now is we can leverage those same AI models to help us with, I'll call it sort of tricky patient scenarios, right? There's a lot of times where I've had to look at patients before and go, hey, I'm not really sure what's going on here, but I'm gonna have to do some homework and spend time after my clinic day and get back to you, right? I'm now in a position where even without giving the AI specific information, because I know people get sort of sketchy about that sometimes, right? I can do things like tell the AI, hey, I have this patient, she's such and such years old, here's her general background, here's the question I'm posing, this is what I think is going on, here's some information that you need to know, tell me why I'm wrong, right? And tell me what other things I should be thinking about here, right? And in a matter of seconds, if not a couple minutes if we're being generous, I can do that homework that I promised to patients a lot more quickly. Just did it today, actually. Have a patient who, she has dizziness. And dizziness is my favorite. Sidebar story. I trained, as we may have talked about before, at Tripler Army Medical Center in Hawaii. Took care of a lot of, we call them dependents, or the spouses of old military personnel. And a lot of those dependents were Filipino women. Now, I love them. My sister-in-law is Filipino. But there's a thing in Filipino culture that we used to joke about, which is your patient's going to come in and say they're dizzy. And that can mean anything from I'm actively having a heart attack to I stubbed my toe, right? Because culturally, that was just the thing. Like, I'm dizzy, right? So fast forward to today, this dizziness that can be so many different things, right? Some of it's dangerous, some of it's not. We kept talking about the non-dangerous things for this particular patient, and it was just itching in the back of my brain that we're missing something. And one of the really dangerous things that's out there, I already had other doctors tell me, no, that's not it, right? So I'm like, you know what, let me try this again. Let me give all this information to the AI. And again, this took all of like 2 or 3 minutes. It confirmed what I was worried about, which is yes, that thing that these other doctors told you is absolutely not the case, could absolutely be the case, and you got to get back to this, right? So this poor patient would have been sitting out there going, I'm fine, and there's nothing else we need to do, had it not been for this AI partner I called on to just really give me that confidence to say, yes, now I'm going to go for second opinions, we're going to do more studies, we're going to make sure that this is not her issue, because if it is, bad things can happen, right?
I am so glad you use that example because I think sometimes with the community, even clinicians themselves may set aside is that there is this gut, this special thing, you called it an itch, that great clinicians have that has to be investigated. And to be able to have, and I really appreciate that you use the word partner as a solution to help unpack that in a way that could be much more efficient so that you could keep focusing on that critical thinking.
Right. And I apologize for the interruption,
Please.
but that's what healthcare is. It's partnerships, right? Partnerships between us as a care team and a patient, and within the care team, right? We're already doing this, right? we have medical assistants and LPNs and RNs and everybody else because I can't do it all. It's not practical, right? So we have people that will greet you at the desk and register you and take your insurance information. We have people that'll help you get into a room and take your vital signs. And now AI becomes that other person or that thing in the room that's doing just more work that we couldn't do before, right? And I think it's really important for people to embrace that partner type of model. My favorite example is this. People get scared of AI, right? And they rail against it. There's lots of arguments in movies and video games and books and media about how bad AI is, right? We've all heard it, right? My favorite is, have you ever watched Iron Man?
I love Iron Man.
See, there we go,
Yes.
right? So everybody watches Iron Man and everybody loves Iron Man and they forget that Iron Man is Tony Stark.
Yes.
And Jarvis.
And Jarvis, there you go. Chuck's got me, right?
does.
So everybody loves Jarvis and
Jarvis.
Iron Man. They're like, hey, this is great. And that's AI, man,
Yes.
Yeah.
right? And as a matter of fact, that's where I want us to get,
Yep.
right? So if we think about where we're going to be in a couple of years, right? Where we need to get away from is this understanding that what we're seeing now is just like when we went to electronic medical records.
Yes.
It's not the case, right? When we went to electronic medical records, right? We took a paper chart and we put it in a
And just
computer,
replicated
right?
old
Yeah.
processes.
It's kind of like taking your phone book and putting it in your new smartphone,
Yes.
right? Same thing, different platform, right? This is a totally new ballgame,
Yeah.
right? AI is truly reinventing the way we do healthcare. And I want it to be Jarvis, right?
love
I want it to be seamless. I want Chuck to walk in a room to talk to me and in the background have that thing that's pulling information for Chuck and going, hey, Dr. Attilio, did you see this,
Yes.
right?
Full picture.
And hey, let me summarize this for you so you don't have to spend 5 minutes in front of Chuck staring at a computer screen, right?
Yes.
And just have that happen in the background, just like in the movies where Jarvis is telling Tony Stark, hey, you know, you should do this. But at the end of the day, it's Tony Stark that saves the world, right?
That's right.
Yeah.
Oh, that's an awesome
Yes.
example.
Yeah.
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 With the time we have left,
Yes.
it's like you've disclosed something hot off the press, which
Yeah.
is AI is going to be part of our strategic plan.
Absolutely.
It's going to be a part of Care Sync.
Has to be.
So in 3 years, what can we all expect from your amazing work?
So remember
Creating
that.
our version of Jarvis.
Yes. Remember that doubling time of medical knowledge thing we brought up, and I brought it up specifically, right?
Yes.
Because I used to look at these plans on like a 5 and 10 year timeline, and I don't think it's that anymore.
Right.
If we look at how fast all of this is happening around us, 3 years is pretty realistic, right? Now, I'll tell you, in 3 years, or over the next 3 years, what I'd tell most people to start paying attention to, and this goes for our employees and just the public in general, is a couple of skill sets are going to become really important, right? The first is communication, right, which we know is always really important in solving problems. But here it's about learning how to talk to AI, right? There are very, very big differences in how
that's big.
you say something to another person.
Yes.
And the same rule applies to AI.
Got it.
Right?
Okay.
So imagine this. Say your nurse practitioner is seeing you in a primary care office, and that nurse practitioner asks the AI, what antibiotics recommended for this sore throat, right? It's very different than that nurse practitioner asking, hey, this person is this old, they have these allergies, these are the symptoms I'm seeing, I think this is a sore throat, how should this be treated, right? And that's just a very high level example, but that skill set, right, of being able to present information and prompt AI correctly is going to be really important, right? The second thing is critical thinking, right, and critical assessment, really.
yes.
Once that AI gives you an answer, our role as the human in the loop is to say, yes, this is helpful, no, this is not helpful, and that's downright wrong,
Yep.
right? And that's what I do with most of my time with the AI, even the example I gave you earlier, right? When I used that tool for this particular patient, it gave me a lot of very useful information. It also gave me some that was less useful and some that I basically just cast aside. What I applied to the patient and actually noted in her medical record was the useful stuff,
Yes.
right? So that's a second skill. The third skill set is really what I just call being human, right? And there's a couple of things in that. We still have an ability to reason in ways that AI can't. And even more importantly, we have an emotional intelligence that's not been replicated. And that, especially in healthcare, is going to become super critical,
Yes.
right? When our staff, down from our nurses all the way to our EVS techs, when they can have that emotional intelligence and engage people with empathy, right? That's going to be really important.
Yes.
So as we look forward to that future, right? Those are the 3 skills I'd tell everybody to emphasize.
That's awesome.
What it's going to look like, right, is our community getting more used to the fact that we're using these things. Yes, they're scary. I don't think they're scary, but other people do, right?
Sure.
Yes, they're new, right? But we have to embrace them because this is what's going to get you the care that you need. When you on AMC Connects talk to so many people about access to care,
Yeah.
AI is going to help us provide that access to care, right? When we talk about keeping your doctor in town, AI is going to keep your doctor in town. When we talk about supporting and sustaining our nursing workforce, that's what's going to do it. So if you walk into the healthcare system going, I don't want that as part of my care, you're actually standing as a barrier to that progress, right?
Yes.
So we need the community to support us, right? And that's everything from, yes, I'm okay with you using this, and trusting that we're doing it responsibly, by the way.
Yes.
We have a lot of policies and guidelines now about how we safely and appropriately implement these, right?
Yeah.
But community rallying around us and us experimenting more with using AI, again, not to replicate the work that we're doing now, but to do new work in different ways, right? Ultimately, I still want to see Jarvis, right? We may be there in 3 years. I've already talked to a vendor partner of
great
ours who is
expectation to
working
set.
on, our vendor partner is working on their description. If you've ever called like an IT help desk and they take over your computer and they move your mouse for you, they're working on leveraging the AI we have now to do just that,
Wow.
right? So as I'm talking, the AI is moving the mouse and running the computer and bringing up everything I need, right? And I think we'll get very close to that.
Oh, you're such a gift. Chuck, didn't you understand AI a little bit better after this discussion with Dr. Attilio?
This is like the 0.5% of the discussion.
Yeah, I was going to say there's a
Scratching
lot
the
to it.
surface.
Yes.
But you are a gift, Dr. Attilio, really, to be able to take some exciting, for some...
Can you take just that clip and give it to my wife?
Go, Catherine.
Yes.
Yes.
Yeah.
To be able to take a concept like AI and
Yeah.
be able to be using it already, working with vendors, championing relationships with vendors,
Yeah.
and then being able to distill it down to help us understand it. Thank you so much.
Yes.
I know people are jealous that we have you.
Yeah.
We're going to white knuckle you,
Yeah.
and we are definitely having you back on to walk us through this
Yes.
and a few other care sync topics. As we
And
go
thank you
forward.
for your patience with me too, because if you couldn't tell, like my brain moves so fast when we talk about this because it is so much. Like when I was stumbling over my words earlier, it's like so many things to talk about
Sure.
that it's like overwhelming the connection between my brain and my mouth. So
No, well, I think that's why I had to dress up today.
Yeah.
Because I get the same, because you and I get in these system conversations of what's really possible in healthcare. And I know we both feel this, that we're really blessed to be in the Rome Health Network because it is a place that has to have transformation and innovation be like a permanent part of our skill sets. So, as we close, thank you again, Dr. Attilio, and please give us some feedback on the topic of AI. Was it a well-timed topic to be able to have everybody be in the loop of a little bit of where Dr. Attilio is for our network and leading us through this important topic? But as always, we want your feedback through the mailbag or some other way. Dr. Attilio is incredibly generous with his time. So if you see him or reach out to him, he is always available to answer questions. So feel free to lean into that a little bit more. But again,
and I have an office now.
Yes, Dr. Attilio does have an office. He was a bit of a nomad for a while, so gracious with
AnneMarie
that.
did not like me for
not.
like a year.
I did not like the nomad.
She was like, "You're in trouble. You don't get an office." No.
But he does have an office, so there can be some private conversations around.
But I bring it up
topics.
because to reinforce your point. I do split my time between the clinic and my administrative work, but the office that I've been able to occupy is right near those main elevators, right in the middle of the hospital, right? So people walk by all the time, patients, staff, and if that door is even cracked, feel free to say hi because I'm happy to talk to anybody about this kind of stuff.
Yes, and we learned something a little bit more about each other. Got Tony Stark in mind. Like we both really like the Marvels. I don't know that I
This
knew
is
that
going to
Tony
be a
Stark-
theme. Last time it was Jurassic Park socks.
Yes.
This time we're talking about Marvel.
This is big.
You quizzed me on my Star Wars movie
Well, because you're
favorite
kind of our
last time.
superhero. Like, let's just be honest.
No, I'm just a nerd.
And in many people's lives, I love this. We're gonna have a lot of we're gonna have a lot of fun with the massive topics that we have going on in healthcare. We still keep in mind that we have to have fun together.
Yeah.
Right?
Yeah.
Healthcare, taking care of people, being with people is something we have to make sure we still have fun with. And I was connecting with a community-based CEO this morning where they were thanking me because they did need care and decided to seek their care at Rome Health, and was really giving us many kudos for their experience. They had a phenomenal experience. We're so grateful for that and so thankful for all of you in the workforce who deliver exceptional care for our community. But it was really neat for me to say, you haven't seen anything yet. What Rome Health is doing and what's coming is just going to be that much greater. And Dr. Attilio,
cool.
It is going to be cool, is highlighting part of our strategy to carry us into the future. So here's to creating the best care out there here.